according to you, Dr. Frieden, we're getting a bad rap globally. In fact, you've said to the National Press Club just a few days ago, and I quote, "There may be a misconception that public health is no longer needed because we have expansion of healthcare access." Well, you turn out to say public health is not healthcare for poor people. Public health is healthcare and health for everyone. Globally, there's perhaps a concern that we've crested in global commitment to public health. So for all of these reasons, there is in some quarters a sense that public health is less and less relevant. What's the problem? Why the disconnect?
I think the challenge that we have in public health is the challenge of making things visible. Often when there's progress, we don't recognize what the progress is because we don't have the illnesses, the injuries, disabilities, and deaths. In addition, there may be large problems happening today that we either have gotten so used to we don't recognize, and I would put the massive number of heart attacks and strokes that are preventable in that category, or there are problems that are happening that we're not recognizing because we're not unleashing every technology that we could that would make a real difference in finding it. And I would put in that category unleashing the microbial genome to try to better understand how organisms are spreading, whether they're resistant, whether they're clustered, whether they're virulent, and how to counteract them and prevent them most effectively. So I think the crux of the problem with public health is making visible that which might not easily be seen otherwise.
Dr. Foti, if you could, is it essentially a situation where you have people who don't understand the process?
I think that could be part of it. I think there's a bigger issue, though, relative to why we're seeing what we're seeing today, whether it's on the medical side or for myself personally on the dental side. And that's the fact that, support is not being provided to those that need it the most. And so what are they doing? They're going to where the care can be given in the most urgent manner, which is usually the emergency room. So they're not accessing some of the public health opportunities because maybe they're not aware of them.
In terms of prevention, which we're discussing today, I think we've made a lot of large steps in the last couple of years. We now cover all the U.S. Preventive Services Task Force recommendations for Medicare, and once Marketplace is coming online, it will also be for those in the healthcare exchanges. So these are breast cancer screening, colon cancer screening, evidence-based prevention interventions, and with no cost sharing. We've had large uptake in that. Two, I think in the broader population health and prevention construct, with our quality measurement programs and our payment programs, we're trying to incentivize prevention and coordination of care. And then lastly, in terms of the innovation center work, we have a number of models trying to redesign care delivery, and many of those, Million Hearts and many others, focus on population health and how we improve the health of populations.
So part of the problem is that we're not looking at this in a holistic way, and we tend to segment the financing, the care, the providers in silos, and we're not looking at it in terms of what's in the best interest of the patient. I would also say that if you look at dental services, patients who are insured, which is, as you mentioned, is only half the population, patients who are insured for dental care, when they turn 65 or 68, whenever they do that, there are no dental services, or relatively few in Medicare, and Medicaid is poorly funded. So you go through a lifetime, for those who have insurance, I'm not even talking about the ones who don't, those who have insurance go through a lifetime of building up their dentition, and then they lose it over the last 20 years of their life because they can't pay for the services. So that's the disconnect.
But we have what has been nicely termed the silver tsunami coming. It's already here if you want to even take it a step further. We're living longer. People are retaining their teeth because they had access to care through insurance, which is usually a limited benefit. It's only a couple $1,000s, but they get to keep their teeth. People are using fluoridated toothpaste. They're doing all the things that we want them to do, fluoride in the water. So now we're dealing with people who are living longer, taking medications, having dry mouth, and getting all the same problems that kids were getting that we're addressing as well. And so that's going to be a huge, huge burden on the economy in this country going forward.
One of the threads that is throughout the comments that we've already heard is that there's a lot of innovation and change going on in how care is delivered, whether that care is through the public health departments and public health population services or more traditional medical care services. But for those, for the ability of programs like Dr. Frieden's or Dr. Conway's to be able to do this innovation and address the needs that have been described, first, we need to know what those needs are, and that's where health services research also comes in documenting the disparities, the lack of access, the outcomes for populations and for communities. And then the other part is why do we have the U.S. Preventive Services Task Force? Because we do systematic reviews of the evidence. We have to connect the biomedical research enterprise all the way through to the reliable, consistent delivery of care to people who need it. Because in this country, too often, geography is destiny. Where you live, what your social context is, will determine whether you will ever benefit from the innovation and progress that we've seen because of research in this country.
One of the things that really does concern me is the lack of consistent investment in prevention. Our threats to health are not coming down by 5% per year. Our opportunities to make progress are not coming down by 5% a year. So from my standpoint as CDC director, where our role is to work 24/7 to protect Americans from threats, I have to say, well, for every bit we're not able to invest, we're less able to protect people.
The innovation that's happening in delivery systems throughout this country to try to get the right care to the right patient at the right time, surgical site infections, central line associated bloodstream infections, we used to have these assumptions about a certain rate of complications being inevitable. Now we know they are preventable. And that's the kind of research we need to keep pushing the limits of how good care can truly be.
There are actually people out there, though, who are fighting Dr. Conroy and Dr. Frieden on many issues with regard to, people being educated more on prevention and methodology and behavior. It's a slippery slope. Don't get involved. Big Brother's coming down.
I think one of the key questions is, what is a unique public good? What is not going to happen if the government doesn't do it? And that includes some research, although there's a very important role for the private sector, for industry, for philanthropy, but some things have to be done by government. It also includes information. We can ensure that there's honest information, whether that's package inserts or accurate marketing of drugs and pharmaceuticals, or menu labeling that gives you the calorie counts, but basic information so that people can make informed decisions. There are also things that we as a government can do collectively, as a society that we can do that we can't do as individuals. So, you might try to put fluoride drops in every glass of water you drink, but it'd be a whole lot easier if we do that at the plant and put them in so you have fluoride automatically. You don't have to go out of your way to do the healthy thing. So there are many roles for government which are uniquely government. And ultimately what we want to do is increase choice. We want to increase people's opportunities to do things. We want to make it so that if you go with the flow in America today, you will end up healthy. Right now, if you go with the flow in America today, 2/3 of adults end up overweight or obese. 1 in 5 adults smokes. So we have a lot of change that we need to make to support people's choices so that the healthy choice is the default choice.
That's so interesting, because I was going to ask, my last question was going to be, at the rate we're going, and this is to everyone, at the rate we're going, if we aren't more innovative, in 50 years we will be blank.
Sick and broke. We need to do a better job in incentivizing people into rural and urban underserved communities and focus more on health disparities. And if we don't do that, we're only fooling ourselves. So where is the research on, not just on the number of primary care physicians, for example, but also on the distribution of those physicians, also on the diversity of the workforce? We know that patients will seek out providers that look like themselves. And yet, if you look at underrepresented minorities, it's less than 10% of the workforce. And yet we're approaching 50% of the population.